Pharmacies have been inundated with thousands of calls and online applications from 18 to 34-year-olds choosing to get early access to a Covid-19 vaccine. The single-shot Janssen jab will be made available through appointment from Monday, subject to supply.
Literally, the phone was hopping. I've lost count of how many rang this morning, to be honest. We stopped taking names and told them to call back on Tuesday.
On the streets of Galway, demand among young people was high.
I guess it makes more sense to get people who are younger vaccinated now because they're the ones going out most so.
The sooner we're all vaccinated, I suppose, the better.
Just get vaccinated because we're going to need vaccines to go back to places like the restaurant and all that.
I don't think there's enough research on it.
Over 700 pharmacies are participating, details of which are available on the HSE website.
There's huge demand, and in fairness, a lot of pharmacists, the first they heard about it was this morning. We're asking people to be patient and to bear in mind that there's only a certain number of appointments available, there's only a certain amount of vaccine available right now.
From July 12th, 18 to 34-year-olds can also opt to register online for a Janssen or AstraZeneca vaccine at a vaccination centre, instead of waiting for an mRNA vaccine in August under the age-based rollout.
The changes that we're implementing from Monday will mean that the 18 to 34-year-old age group will have the option of being vaccinated 1 to 2 months early.
It has also been confirmed that from this day next week, the online registration portal will open to people aged 30 to 34 for the mRNA, Pfizer or Moderna vaccine. It comes as the government announced that it is set to buy 1 million mRNA vaccines from Romania, where uptake is low.
It's very good news, it's very welcome. I thank the Romanian President for this response to our situation, and we're particularly obviously concerned with the Delta variant.
Meanwhile, the Health Minister also said today the administration of second AstraZeneca doses to 60 to 69-year-olds is set to be completed over the next 10 or 11 days. Fergal O'Brien, RTE News.
West Waterford is one of the areas around the country experiencing an upsurge in COVID cases, with between 180 and 200 cases recently confirmed in Dungarvan and the surrounding area.
West Waterford is no different to any other county. It can break out anywhere. It doesn't matter like where you're from.
Everyone's being extra careful in that, and there's nothing else really you can do. Only try to do the bit yourself. You can't be putting the blame on anybody else.
Dublin, Donegal, Sligo and Westmeath are also seeing high or rising case numbers as Delta becomes the dominant strain here.
We are going to see a wave of infection, and the only question is what size that wave will be. It is not inevitable for an individual or for an individual family or an individual community that they've got to be hit by this over the coming weeks and months. And while the virus is more transmissible, it is equally vulnerable to all of the basic public health measures that people have been doing over the last 18 months.
A month ago, the Delta strain accounted for fewer than 10% of COVID-19 cases here. But preliminary data from the first part of this week suggests it now accounts for 70%. And the director of the National Virus Reference Laboratory, Dr. Cillian de Gascoigne, predicts it will reach 90% in a couple of weeks. It was against this backdrop that reopening indoor hospitality was paused until at least the 19th of this month. That's also the date we are due to see a return of international travel, with our adoption of the EU's Digital Green Certificate.
At the moment, I'd be more concerned about international travel. Obviously, the government is now looking at a vaccine cert to facilitate the opening of indoor dining for vaccinated individuals. So I think that's something over which we have far more control, whereas international travel, I think, is likely to be a bigger risk in the coming months.
Experts say there is still more to learn about the Delta strain. Its impact both at home and overseas is being closely watched. Laura Fletcher, RTE News.